we evaluate the horse from all different sides, looking for any type of asymmetries, looking at conformation, looking for atrophy or abnormal swellings, or abnormal angulations or abnormal posture. And so we just, and we try to do it with the horse as square as possible. That way we get a true visual representation of the horse. One thing to notice on this horse is she's got fairly severe atrophy of the supraspinatus, infraspinatus muscles in the left shoulder, very prominent point of the shoulder here, and that's because this horse does have severe DJD in the scapulohumeral joint of the left front. And so we know about that, so we're not going to be too concerned about that. So after that, you're actually going to start doing your chiropractic exam. Always start by introducing yourself to the horse and letting them know that you're there. And then the first thing that I like to do is palpate the muscles at their pole. And in order to get them to do that, you have to have them lower their head so they relax. And so I bring her down and I'll palpate, and I'm palpating for fibrosis or pain, and she palpates quite normally there. After that, I'll be coming up underneath and palpating for symmetry between C1 and the ramus of the jaws, and then I'll come down and actually palpate on each one of the cervical vertebrae, trying to feel for pain. Quit it. After that, I'm going to motion C1, first cervical vertebrae, and so I motion, and what I'm trying to do is evaluate motion from side to side, comparing one side to the other. So I'm palpating left C1 occiput there and right C1 occiput there. And I find that she's a little bit tight on left occiput C1. Quit it. So I'm going to make an adjustment here. And I have to rotate her head, and now that's the adjustment. So I adjusted occiput C1. Now I'm going to start doing motion palpation on her cervical vertebrae, and I'll take her and I'll start palpating and bending her head, and what I actually feel for is the vertebrae actually collapse away from me at each articulation. And so wherever I have abnormal motion is where I'm going to make the adjustment. So coming down, C1, C2, C2, C3, C3, C4, whoa. C5, C6, and she starts to turn her head a little bit, so she's got a little bit of a fixation here at 4, 5. So I'm placing my hand at the articulation of 4, 5, bending her head and making the adjustment. And so that is a cervical adjustment at 4, 5 on the left side. Now after that, I will come back and do it again to the right side. So now I'll come here on the right side, bend around. She's got a fixation here, quit it, at 3, 4. So I'm coming in, putting my hand, bending around, and adjusting. It's a high velocity adjustment in a very precise location. There we go. Good girl. Now, usually after that, I try to see what their range of motion is as far as carrot stretches. And she does a pretty good job for a horse that's 25 years of age. She does a reasonably good job. Come on. She's a little bit slow down in her lower cervical. So I'm going to come down and adjust her at 5, 6, 6, 7 in this area. There we go. All righty. So now I'm going to work my way down the back, starting at the withers, which is the dorsal spinous processes of the thoracic vertebrae, and I'm motioning those to see if they're painful or if they motion properly. Then I'm coming down the dorsal spinous processes of the thoracic and lumbar, very lightly first, checking for skin pain, then coming a little bit more for ligamentous pain, just motioning my hand right down the dorsal spinous processes, and then coming down hard, feeling for bone pain. And she has none. Then I'll come and actually palpate the muscles for pain. Usually what will happen is the muscle will contract and spasm if they've got muscle pain. And so usually I use the blunt heel of my hand. After that, I'm going to motion their vertebrae from side to side. And I'm putting my hand on each one of the dorsal spinous processes, and I'm actually feeling them move from side to side. Oh, baby doll. Okay. At the same time, I'll come in and do what is called a sternal lift, and that's where I move them or tickle them on their sternum, and they will actually raise their back, and I'll watch and see if they've got normal motion here, and then I do what is called butt tucks, and I'll watch and see if they've got normal curvature of their back, and she does good there. Then I would repeat the same on the other side as far as motioning, and again moving from side to side. Checking the withers, and then checking muscle. Now she's a little sore right there on this right side. So what we'll do is when I palpate her vertebrae from above, I will determine, is it truly pathological, or is she just goosing just normally. Then I come across the tuberous sacrali and mash them together. A horse that has sacroiliac pain will actually unlock their stifles. It's not uncommon for them to move away from you, but if they unlock their stifles, then that is usually an indication of sacroiliac pain. So I come here and press across it. You can see she moves down a little bit, but she doesn't unlock her stifles, so she really doesn't have any sacroiliac pain. From this point, I come and put my fingers in between the tuberous sacrali, and I motion or pull down on the tubercocci, and what I'm doing is evaluating motion and I compare it to the opposite side, and she has fixation on her right sacroiliac joint, so we'll make an adjustment on it. Then I come down and I palpate the sacral tuberous ligament on both sides and compare one side to the other. See, she doesn't move here, so she's actually in pretty good shape on the left side. However, I was getting a little bit of pain here on her right side, which tells me that her sacrum has a slight deviation to the left, which we will adjust. I put my hand on the tuber sacrale right here, and then my opposite hand is on the apex of the sacrum. I'm in line with the sacrum, and then I will actually make an adjustment right there. So that was the adjustment for the sacral apex. So remember, she has got a right sacroiliac fixation. Oh, baby, right there, right there. So I place my hand on the tuber coccyx, put some pressure on it, and then make an adjustment. So that was the adjustment for a right sacroiliac fixation. And I'll do it one more time. So, there we go. That's the adjustment. She's moving better there now. But starting at L6, and I'll motion up and down. L5, 4, 3, 2, 1, and actually she's got some decreased motion at L2. So I'm going to make an adjustment right there. Okay, now I'm T18, 17, 16, 15, 14, 13, 12, 10, 11, and that's pretty much it. Okay. Another method for adjusting the sacroiliac joint is to come in on the tuber sacrale and adjust in the direction of the joint, which is that right there. So we've adjusted it. Then I'll go back through and simply mobilize, check the mobility of the thoracolumbar spine in general. From here, I'll palpate her tail, making sure there's nothing going on in the tail. Most horses, you should be able to bring the tail all the way over, going slowly, and she palpates normally there. So her tail is in normal shape. The coccygeal vertebrae. I turn her this way. From here, I usually palpate the front extremities, and so I'll lift them up, palpate. I don't want to do a lot on this leg because she's a little stiff on it. And then I'll palpate and flex the opposite joint. Motion her shoulder, scapula, looking for abnormal motion there. And then we're going to finish up with the TMJ joints. And I motion the mandible from side to side. I like to feel kind of a clunking from each side. You can also look at the teeth and look at how much excursion that you have in the lower jaw. She moves very nicely. So she has no TMJ. Quit it, quit it, quit it, quit it. Quit it. So she has no TMJ issues. So that's it.